When you visit the dentist with a damaged tooth or cavity or a tooth that is in pain, sometimes the dentist will recommend a filling or a root canal after they have done the investigations and listened to the complaint. So what is normally the distinguishing factor between a root canal or a filling? So a filling will be done mostly when the tooth is not too badly broken down, where only maybe the first two layers of the tooth have been affected by the cavity or the fracture or the caries. And now a root canal will be done when there's been infection to the pulp, or if it was a fracture, it has gone up to the pulp level where there are nerves and blood vessels. So other than the cost implications, you will find that the root canal is much more costly than the filling. You'll also find that filling will probably be done in one appointment, and some root canals might be done in 1 or 2 up to 3 appointments. Also, you'll find that in most cases, if the tooth is too badly broken down, there might be an indication for a crown, which is a prosthesis after a root canal, which might not be the case after a filling. So normally, it is advised that you visit the dentist early on, so that if it's a filling, it can be done without having to go up to the point of or you might require a root canal if the caries progresses to that level.